Have you ever wondered how pregnancy is managed with sickle cell disease? Welcome back to our Victory Education Lounge. I'm your host, Maurice, and today we're tackling a topic that's both important and personal. Expecting with Sickle Cell, Pregnancy Planning Guide, Part 11. We encourage you to interact with us by liking this video, subscribing to our channel, and sharing your thoughts in the comments section. Pregnancy is an amazing journey, but for women with sickle cell disease, it can come with its own unique set of challenges. Today, we're taking a closer look at how to navigate pregnancy while living with sickle cell disease. We'll discuss key aspects of preconception planning, genetic counseling, high-risk pregnancy considerations, potential complications, and the importance of multidisciplinary care. So, are you ready to dive deeper into the world of expecting with sickle cell disease? Let's dive into the real-life scenarios that can illustrate the journey of expecting with sickle cell. Meet Sarah. She's 28, has sickle cell disease, and wants to start a family. Sarah understands that her journey to motherhood might be a bit more complex due to her condition. So she schedules a preconception appointment with her hematologist and obstetrician. At this meeting, her doctors discuss the importance of optimizing her health before pregnancy. They review her current medications, making necessary adjustments to ensure they're safe for a potential baby. They also conduct a comprehensive health screening to detect any underlying issues that could complicate a pregnancy. The team emphasizes the need for Sarah to maintain a nutritious diet, engage in safe physical activities, and manage stress levels for optimal health. After this meeting, Sarah feels empowered, knowing she's taking the right steps to prepare her body for pregnancy. Sarah's story emphasizes the importance of pre-pregnancy planning. It's about taking control and making informed decisions for the health of both mother and baby. John has sickle cell trait, and his wife Lisa has sickle cell disease. They're planning to have a baby. Now this is where genetic counseling comes into play. It's an essential step for couples like John and Lisa who are planning their pregnancy journey. As we know, sickle cell disease is a genetic condition. This means it can be passed down from parents to their children. For John and Lisa, understanding the risk of passing sickle cell to their child is paramount. Genetic counseling is a process that helps individuals or couples understand the chances of having a child with a genetic disorder. A genetic counselor is a healthcare professional trained to guide and support patients seeking information about how inherited diseases might affect them and their families. So what happens in a genetic counseling session? John and Lisa will meet with a genetic counselor who will review their family histories, explain the inheritance patterns of sickle cell disease, and discuss the potential risks to their future child. In John and Lisa's case, since John carries the sickle cell trait and Lisa has sickle cell disease, there's a 25% chance with each pregnancy that their child could have sickle cell disease. There's also a 50% chance their child could inherit the sickle cell trait like John, and a 25% chance the child could inherit neither. It's important to remember that genetic counseling is a conversation, not a test. It's about providing John and Lisa with the information they need to make informed decisions about their family's future. The counselor's role is not to tell them what to do, but rather to help them understand their options and support them in whatever decision they choose to make. Armed with this knowledge, John and Lisa can make an informed decision about their future family planning. They can explore options such as prenatal testing, in vitro fertilization with pre-implantation genetic diagnosis, or even adoption. Genetic counseling is a crucial part of pregnancy planning when sickle cell disease is a factor. The journey may be challenging, but with the right knowledge and support, John and Lisa can navigate their path towards parenthood with confidence. Maria, 32, with sickle cell disease, is in her second trimester. At this stage, her pregnancy journey has intensified. She's carrying not just the joy of expecting a child, but also the weight of a high-risk pregnancy due to her sickle cell disease. Maria's pregnancy is considered high risk because sickle cell disease can increase the likelihood of complications. As the months pass, she starts experiencing more frequent pain crises, a common symptom of her condition. These crises are sudden, severe episodes of pain that occur when sickle-shaped cells block blood flow to parts of the body. The pain can be intense, and during pregnancy, it's even more critical to manage it promptly and effectively. Beyond the physical discomfort, these crises can cause stress and anxiety for Maria. They serve as a constant reminder of the complexities of her journey. But rest assured, Maria is not alone. She has a dedicated team of healthcare professionals who are well-versed in managing high-risk pregnancies, particularly in women with sickle cell disease. Her team includes a hematologist who helps manage her sickle cell disease and an obstetrician who oversees her pregnancy. They work together to monitor Maria's health closely, adjusting her treatment plan as necessary and ensuring she gets the best possible care. One day, Maria experiences a particularly severe pain crisis. Her doctors decide to admit her to the hospital for close monitoring. While hospitalization may seem daunting, it's a proactive measure to ensure both Maria and her baby's safety. In the hospital, Maria's pain can be managed more effectively, and the health of her baby can be closely observed. The journey is not easy, but Maria's courage and the support of her healthcare team make it possible to navigate this high-risk pregnancy. Even in the face of pain and uncertainty, Maria remains hopeful, always looking forward to the day she can hold her baby in her arms. Maria's story highlights the need for specialized care during a high-risk pregnancy. Her experience underscores the importance of a multidisciplinary approach and the need for vigilant monitoring of both mother and baby's health. It's a testament to the strength and resilience of women like Maria, who brave the challenges of pregnancy while living with sickle cell disease. Aisha, 35, with sickle cell disease, is about to give birth to her first child. This is a moment of joy, triumph, and relief. But behind this moment lies a journey of meticulous planning, regular checkups, and preventive measures that ensured a successful pregnancy for Aisha, despite her condition. Aisha's story begins with her decision to start a family. Aware of her health condition, she sought medical advice before conceiving. Her healthcare team, comprising of her hematologist and obstetrician, developed a comprehensive preconception care plan, optimizing her health for pregnancy. This included adjusting her medications and conducting health screenings to ensure she was in the best possible shape to carry a child. Once she conceived, Aisha's pregnancy was classified as high risk due to her sickle cell disease. This meant more frequent prenatal checkups than a typical pregnancy. These regular visits allowed her healthcare team to closely monitor her and her baby's health, ensuring early detection and management of any potential complications. Alongside her checkups, Aisha also followed a preventive care plan designed to reduce the risk of crises and improve her baby's growth. This included maintaining a healthy diet, staying well hydrated, and getting plenty of rest. She also worked with her healthcare team to develop a safe and effective pain management strategy, which was crucial in improving her quality of life during pregnancy. Blood transfusions were another preventive measure in Aisha's care plan. These were used judiciously to prevent complications such as severe anemia and pain crises, which could potentially harm her or her baby. Aisha's journey was not easy. It was filled with challenges and uncertainties, but with a strong support system, a dedicated healthcare team, and her own resilience, she was able to navigate her pregnancy successfully. Today, as she holds her healthy baby girl in her arms, she knows that all the efforts were worth it. Aisha's story is a testament to the importance of regular prenatal care and close monitoring. It highlights that while pregnancy with sickle cell disease can be challenging, with the right care and preventive measures, it can also be a journey of joy and success. Jamal and Zoe have just learned they're both carriers of the sickle cell gene. This news has stirred up a whirlwind of emotions, and they're facing a difficult decision about their future family. The reality is, there's a 1 in 4 chance that any child they conceive naturally could inherit sickle cell disease. This is a significant risk, but it doesn't mean that Jamal and Zoe can't become parents. They have several options on the table, each with its own set of considerations. One option is adoption. This path eliminates the risk of passing on sickle cell disease and offers the opportunity to provide a loving home to a child who needs one. However, adoption is a complex process and can be emotionally challenging, requiring patience and resilience. Another possibility is in vitro fertilization, or IVF, with pre-implantation genetic testing. This procedure allows the couple to create embryos in a lab, which are then tested for sickle cell disease before being implanted in Zoe's womb. This significantly reduces the risk of having a child with sickle cell disease. However, IVF is a costly and emotionally taxing procedure, and it doesn't guarantee a successful pregnancy. Alternatively, Jamal and Zoe could choose to conceive naturally and use prenatal testing to determine if their baby has sickle cell disease. This option puts them in a position to make difficult decisions during the pregnancy, including whether to continue the pregnancy if the baby is affected. Despite the challenges, Jamal and Zoe remain hopeful. They're committed to educating themselves and making an informed decision that aligns with their values, their resources, and their dreams for their family. Their journey is a reminder that sickle cell disease doesn't have to be a barrier to parenthood. It merely presents a different set of challenges that require careful consideration and planning. Jamal and Zoe's story shows us that there are different paths to parenthood when faced with the risk of passing on sickle cell disease. Pregnancy with sickle cell disease can be challenging, but with the right care and planning, it is manageable. From Sarah's pre-pregnancy checkup to Jamal and Zoe's difficult decision, we've journeyed through a myriad of experiences that demonstrate the realities of planning for a pregnancy when living with sickle cell disease. Preconception planning, genetic counseling, and specialized care are vital steps in this journey. They allow for the best possible outcomes, reducing risks and preparing for potential complications. And let's not forget the importance of considering all available options, just like Jamal and Zoe did. Each pregnancy is unique, and every expecting mother deserves a tailored approach that suits her individual needs and circumstances. It's a journey filled with joy and challenges, but it's a journey that you don't have to walk alone. Remember, knowledge is power. The more you know, the better you can prepare for a healthy and successful pregnancy, even with sickle cell disease. Before we wrap up, a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this important discussion. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more valuable content and reach those who need this information. Until next time, this is Maurice, reminding you that with proper planning and care, the journey of expectant motherhood can be navigated safely, even with sickle cell disease.